Hello, everyone. We'll just get going in a minute or so as we just allow people to join. Thanks. Okay, well, I think we'll get started. I think people are still joining, but we'll get going with the event. So thank you, everyone, for coming along to this launch event of the final report of the Observatory for Monitoring Data-Driven Approaches to COVID. The project is a collaboration between Northumbria University and the Royal United Services Institute and is funded by the Arts and Humanities Research Council. It's been a fairly rapid response project, working for a year to look at the legal, ethical and practical implications of the use of data-driven approaches to COVID-19. Hence, many of the researchers on the call today are probably looking quite tired, feeling quite tired. It's been quite an intensive year of work, resulting in this final report and practitioner guidelines. So this event today is intended to highlight a number of the findings and recommendations from our work, but also bring together many other researchers and experts who have been looking at these data-driven approaches from various respects over the last year and hear their perspectives as well. So we're really pleased that Professor Helen Kennedy from Sheffield University will be giving a keynote address later. I'll introduce Helen more formally later on, but we're particularly pleased to bring together her expertise on data into our project launch. We'll have a great panel of experts later on, bringing their perspectives on the findings of our project. And we're also going to be hearing from two experts in the area of children's data a bit later on. Just to highlight some of my thoughts around our project findings before we get going and hear from others. Our interviewees throughout the project told us about the importance of data in order to deal with the emergency that we've just been through during the COVID pandemic, but also of knowing the limitations and uncertainties of data, the importance of local expert knowledge and of qualitative as well as quantitative data, and also the importance of capturing the views and needs of underrepresented groups. And I think all these points which we bring out in the final report are crucial to keep in mind as we think about the government's consultation on the data protection reforms, particularly around automated decision making, and as further debate is happening around the national data and AI strategies. So without further ado, I'd like to first of all move to our first two speakers who are going to focus on the children's research around the use of data and children, and particularly focus on that need to hear the voice of underrepresented groups, including children. So I'm really pleased to hand over now to Dr. Claire Besant, who's an associate professor in law at Northumbria University and one of OMDDAC's researchers, and also to Jen Persson, who is, I'm sure, very well known to many of you as founder and director of Defend Digital Me. So I'll hand over to you, Claire.
Thank you. So in the initial stages of the OMDDAC project, during our stakeholder mapping and landscape assessment exercise, we approached a wide range of individuals and organisations to determine what data-driven approaches were being taken in response to the pandemic and which were considered most significant in terms of risks and benefits. We were keen to ensure we captured issues affecting all sectors of society, so we approached several national organisations who we thought might be able to provide insight into the child's perspective. Unfortunately, none of those organisations responded. We were trying to decide how to deal with that at the time when Barnardo's then published its report supporting the hidden victims of COVID-19. And a key comment in that report which resonated me was one that said that throughout the pandemic, children and young people have told us they didn't feel heard, yet the decisions being made affect their futures most of all. This raised a question that we felt that the OMDDAC project needed to explore, which was, are young people aware of how data, including their own personal data, is being used during the pandemic? And if so, what views do they hold about its use? The OMDDAC project is a rapid response project, so it ran from November last year to November this year, and it's therefore a relatively short timescale. We were conscious of the difficulties in recruiting young people at the best of times. And at the time when we decided to undertake our research with children, we were back in the middle of the third national lockdown. As a result, we decided to work with Investing in Children, who are a children's rights organisation based in County Durham. And they use an agenda day approach to encourage young people to express their views on issues affecting them. Young people, known as facilitators, are supported by a project worker at Investing in Children, and the facilitators lead questioning, take notes and write a report of the agenda day. And the day itself is an entirely adult-free zone. During the height of the pandemic and into the summer, these agenda days obviously had to move online, taking place via Zoom. And Investing in Children advised us that they were aware that some young people were starting to experience Zoom fatigue. And so they suggested that the young people also be offered an opportunity to provide their views via an online survey. In total, 17 young people engaged with Investing in Children to provide their views either through the agenda day or the online survey.
Claire, I think you're on mute.
Sorry.
Yeah.
So young people were asked explicit questions to find out what they knew about the government's response to COVID, how they acquired that information, whether they felt they'd been given enough information about the government's response to the pandemic and how their data is being used. And they were also asked whether they thought that their views had been considered enough. We also explored some of the issues that had come out of the earlier work packages from OMDDAC, using scenarios to explore issues such as how the young people felt about their wastewater being tested, to find out if people in their locality or their street had COVID, and how they'd feel about such information being shared with health professionals, the police, the local authority, or even the Prime Minister. They were asked how self-isolation requirements had impacted upon them and how they'd feel if the police were given information that they or a member of their family was self-isolating, and how they'd feel about their family being monitored to check it was complying with self-isolation requirements. We also posed a scenario where an algorithm was used to determine exam results, something very similar to the scrap plan from 2020. The young people who participated in our research were aware of many of the measures introduced by the government to address COVID, mentioning social distancing, mandatory wearing of masks, vaccinations, the tiered travel scheme, test and trace, the NHS COVID app, and self-isolation requirements. Some of the young people also had an awareness of the way that their data was being used to protect public health, mentioning monitoring of data relating to infection, hospitalisation and mortality rates, and also mentioning wastewater analysis. The young people said that they used various methods to obtain their information, referring to sources such as social media, schools, family and friends, and televised or printed news. They also referred to the government's own website, but they described this as difficult to read and understand and difficult to navigate. The young people offered a variety of responses when asked to comment on how their information had been or might be used. When asked what they thought about wastewater being tested to identify COVID hotspots, more than half of the young people were in favour of this approach. 2, however, weren't entirely sure of their views, and 4 objected to the idea, one explicitly commenting that consent should first be sought. When asked whether they thought such information should be shared with the local authority, health professionals, the police, the Prime Minister, all or none of these groups, they again offered different views as regards who they thought the information should be shared with. Although most agreed to some information sharing generally, they were less likely to agree to information sharing with the police than with either health professions or the local authority. And interestingly, they were also less likely to be willing to share information if information was not anonymised, which correlates with some of the findings of the public perception survey that will be discussed later. When the young people were asked whether they'd feel happy about the police having information about their family being told to self-isolate, again, the young people were generally not in favour of this. There was some evidence that these young people mistrusted the police. 3 specific comments were made by the young people for not wanting the police to have self-isolation information to monitor them. 1 suggested that the police might be corrupt or have biases, which could lead to unequal fines. Another referred to fines impacting disproportionately on poorer families who cannot pay or who might have no choice but to go to work in breach of self-isolation rules. And a 3rd suggested it could either be seen as an invasion of privacy or that the police should be doing more important things. When asked about the use of algorithms to determine exam results, the views were again split between those who thought this was an unacceptable approach to determining grades, which was the majority view, those who were unsure, approximately a 1/3, and a very small minority who thought it might be a good idea. But the fact that young people weren't consulted about this or other issues directly impacting upon them was raised explicitly by the young people as an issue for them. A key message that came through from the young people's responses was that insufficient attention had been given to ensuring that they were informed in a manner that they could access and understand. Many of them seemed to have views about how their data should have been or should be used, but they hadn't been asked for their views, even when they wanted to be asked. And this meant that their views hadn't been considered. More generally, the young people said that they didn't think young people were considered enough. This study set out, as I said at the beginning, to explore whether young people were aware of how their data had been used during the pandemic and to determine what views they might hold. It aimed to provide young people with a voice at a time when there was increasing research evidence that young people's voices were not being heard. It's obviously a small-scale study and it's not intended to be representative. And it obviously also focuses on a relatively narrow or limited issue in data-driven decision-making. But it suggested, however, that this study does highlight wider issues of concern. It confirms, of course, a bigger issue that's been identified by other researchers during the pandemic, that there's been a lack of engagement with young people generally, even in key areas such as their education. The use of children's data is also arguably an increasingly important issue, an issue which this research indicates some young people are aware of and on which they hold views which they would like to be taken into account. During the pandemic, young people's data has not only been used in responding to COVID, but as young people's social lives and education have increasingly had to move online, so have the opportunities for EdTech and other organisations to harvest young people's data. It's concerning, therefore, that whilst the use of children's data by government, by schools and by commercial bodies appears to be increasing, the government's recent consultation, Data a New Direction, only briefly mentions young people in one section. And children, young people and the organisations that engage with them are conspicuously absent from the list of organisations and individuals which the government focuses upon in its consultation. The young people who spoke to Investing in Children on behalf of OMDDAC suggested a variety of ways in which their views could be captured through schools, through surveys that are circulated via schools, via social media and via youth organisations. But it seems, however, that more also needs to be done to make sure that young people are aware of the issues that might affect them so that they can provide an informed response when their data is used. This research obviously didn't set out to determine a strategy for engaging with young people or informing and consulting them about the use of their data, but it suggests that a strategy of this type is needed. It suggested, however, that young people are the best people to determine what approaches are used for engaging with them. As this research illustrates, young people have very different views. They're not a homogenous group. They have different experiences and they will, of course, have different needs.
Thank you, Claire. I'm really delighted to congratulate Claire and her colleagues today on this work, and I hope that policymakers will recognise the value of it and that it will influence change. What strikes me in particular are the three key findings that I want to reiterate. That young people want to be heard, the OMDDAC work with Investing in Children that heard young people's views about the loss of trust where data has conflated purposes used by different people, and the concept of being data-driven under COVID conditions. But I think it's important to reiterate that this research, whilst very current as a rapid response, also reflects a continuum of similar findings in the same context over time. Claire's work comprehensively backs up the consistent findings over 10 years of public engagement, including with young people. The 2010 study with young people conducted by the Royal Academy of Engineering, supported by research councils and Wellcome, discussed attitudes towards the use of medical records and concluded these questions and concerns must be addressed by policymakers, regulators, developers and engineers with regards to record-keeping systems and the linking of databases. In 2014, the House of Commons Science and Technology Committee in its report, Responsible Use of Data, said the government has a clear responsibility to explain to the public how personal data is being used. The same committee's report in 2016 concluded that data collected many years before and no longer with clear consent trails is unsatisfactory, left unaddressed by government and without a clear public policy position. You can look to 2014, the Royal Statistical Society and Ipsos Mori work on the data trust deficit with lessons for policymakers. 2019, Everyone did work with public attitudes. 2020, the ICO's annual track survey results. They all reiterate the findings that Claire has brought out, that young people and adults too are not being heard when it comes to their views on data policy. There is a growing body of literature to demonstrate that the implications of what being data-driven in society for the datafied child, as described by Deborah Lupton and Ben Williamson in their own research in 2017, will mean. The UK government and policymakers are simply ignoring this inconvenient truth that legislation and governance frameworks, such as the UN Convention on the Child's General Comment on Children in the Digital Environment, published just this year, demand that people know what is done with data about them, and it must be applied to address children's right to be heard in ways that are accessible to them to exercise their rights. And people don't think about this in terms of data rights and data protection, but rather as human rights and protections for the human being from the use of data that gives others power over their lives. This project found young people's trust in the use of their confidential personal data was affected by understanding who would use the data and why, and how it would be protected to protect themselves from prejudice and discrimination. We could build easy reporting mechanisms at public points of contact with institutions, such as those explored in this report, whether it be in education and social care, welfare, policing, to produce reports on demand of the information you hold about me and enable corrections. It would benefit institutions by having more accurate data and make them more trustworthy if people could see, here's what you hold and here's what you did with it. But instead, the new government proposals for data protection reform mentioned by Marion and Claire suggest making this process harder by charging for subject access requests, something that will disproportionately affect children. The public perception study that we discuss later shows that not only children's views, but adults' views are being ignored, not only from the pandemic, but over 10 years of public policy and data. So what do these findings mean for public policy? Without respect for what people want, there is no social license for these data policies. And whether it's confidential GP records in 2014, this year, the school census and expansion in 2016, when public trust collapses, so does your data collection. Yet the government stubbornly refuses to learn and seems to believe it's all a communications issue, something like the yes minister approach to foreigners. When they don't understand, just shout louder. But in fact, this OMDDAC research shows data policy failures are not fixed by communicate the benefits, nor is it fixed by changing data protection law. The report finds the UK data protection law is a how-to, not a don't do. And yet under COVID conditions, the data powers of data protection law are being used as a cover for the attack on data protection law in the future. The DCMS consultation, open till November the 19th, uses the emergency situation from the pandemic to suggest that similarly reduced protections on data distribution should become the norm. Whereas data protection law is written expressly to accommodate things that are permitted out of the ordinary in these extraordinary circumstances, but they are limited in time. Instead, the government proposes now things that were found convenient under COVID become commonplace, such as removing Article 22 and its protections from automated processing that the report mentions the young people felt most discriminatory in the summer of 2020. And this mutant algorithm was something, again, that overwhelmingly young people felt left out of in decisions about them, despite being in the group that would feel its most negative effect. The risks and benefits of power obtained from the use of data is felt disproportionately across different communities and by children. So I hope that the powers that be in the National Data Protection Consultation and at DCMS and wider policymakers will take this work very seriously and not only listen to children, but act on Claire and her colleagues' recommendations.
Thank you very much, Jen and Claire, for those really important and powerful messages. And the questions that Jen highlighted there, that the children were asking, who will use the data and why, and how will it be protected, are really key questions that we all want to know the answers to, and particularly important for the use of children's data. So I'm sure that we'll come back to these issues in the discussion and Q&A later. But thank you very much for that presentation and opening this session so effectively. So I'd like to move on now to our keynote address from Professor Helen Kennedy. Professor Kennedy is Professor of Digital Society at the University of Sheffield, where she directs the Living with Data programme of research. She is interested in how digital developments are experienced by ordinary people and how these experiences can inform the work of digital practitioners in ways that overcome inequalities. She researches the perceptions of and feelings about datafication, which we've just heard about from Jen, the possibility of data-related agency, and whether engaging with data mobilizes people to act. Her most recent books are Post, Mine, Repeat, Social Media Data Mining Becomes Ordinary, published in 2016, and Data Visualization in Society, published in 2020. So I'm really pleased to hand over to Helen, and there will be a short opportunity at the end of Helen's talk for Q&A and any comments. Thank you.
Hi, and thank you very much for the invitation to talk to you today. I'm just going to hope to share my screen with you. Already not doing it, I think. Sorry. Try again. Can you see my screen? You'll have to speak because I now can't see anything except my screen.
Yeah, we can see your slides now, thanks.
Yeah, you can see them, yeah. Sorry, I'm in the office where, you know, the technology is 18 months behind me. So, yeah. Okay, so, yeah, thank you for inviting me to talk. I now can only see my slides. I can't see anything else, so shout at me if there's anything that you need me to know. So yeah, we all know that data has been centre stage through the pandemic, that there have been loads of bar charts and line charts in the news, that uses of data have been hotly contested, that there's been a degree of interest in what the public thinks about uses of data to manage the pandemic, including by OMDDAC itself, and we just heard about some of that in the last two presentations and elsewhere. That the CDEI has surveyed public attitudes to the use of AI and data-driven tech to manage the COVID response, and there's been other research as well about public attitudes to contact tracing apps, vaccine passports, and other COVID data management tools. So I'm not personally an expert on public perceptions of COVID-related data measures, although I have spoken to some people about some of those things. But what I hope to do is to sort of offer some insights from my own research into people's thoughts and feelings about data-related phenomena, which I hope will be of value to OMDDAC's research and policy influencing agendas. I want to start with two observations. The first is that these are both about terminology. The first observation is that there is no such thing as the public. And that's not only because, as Warner has argued, publics are brought into being in various ways, as opposed to being out there and pre-existing, but it's also because the notion of a singular or homogeneous public obscures the differences and inequalities that characterize diverse publics, which I think is a much better term. And then the second observation about terminology is that a lot of survey research in this domain explores, quote, people's willingness to share their data, end quote. And I want to suggest that that is the wrong framing. It suggests that people have a choice to share or not to share, which is not the case. And it suggests that the concept of sharing has connotations of giving freely in a context characterized by equal social relations, which is misleading at best, as Nicholas John points out in his work about the sort of connotations of sharing. So you'll find me avoiding that kind of terminology for those reasons. So as was said in the introduction, I manage this program of research called Living with Data, and I'm also currently working on a Nuffield Foundation funded project with the same name, which has got lots of elements. I'm just going to comment a little bit on the survey that we've done as part of this bigger program of research and pull some things out that I think are relevant to the work that you folks are doing. So we surveyed 2,000 people about different aspects of data practices and data uses, and we're really interested in focusing on specific data uses because I don't think it's helpful to ask decontextualized questions about attitudes to datafication or data uses. I'm also interested in looking at public sector data uses because up until fairly recently, it was more the kind of high profile commercial uses that were being discussed. So great big survey, loads of effort getting the questions right, administering it, analysing it, and I'm going to sum it up in one slide alone, and pull out what the key findings were for us. So we find that public concern about certain data uses remains high. It's been found to be high in the past in other research, some of which was referenced by Jen. And it's particularly high about particular aspects of data uses and about data uses in particular contexts. It's not high about all data uses. We're also interested in the fact that if you sort of corner people into answering survey questions about whether they're concerned or not concerned about data uses, they might say they are, and then go about their everyday lives not in the least bit concerned. So what we asked people to do was to rank their concern about fairly broad and fairly narrow data uses in comparison to concern about other things like Brexit, the economic costs of COVID, funding for the NHS, and other things like that. And we found that concern about data uses was pretty high. Concern about data being used in unfair ways was the third highest concern, after concern about the economic costs of COVID and funding for the NHS. But concern about personal data being used to manage COVID-19 was low. It was the lowest concern in a list. So what we're sort of finding from those 2 points is that context really matters. Context is a defining factor when it comes to public attitudes to data uses. And so it's not useful to talk about public attitudes to data uses out of context. And then finally, one of the things that we wanted to do that hadn't been done in surveys so far was to compare how much people know and are aware of data uses with their attitudes to them. So the .everyone surveys, for example, they've asked some questions about knowledge, some questions about attitude, but they haven't compared the two things. And what we found is that people who know the most are the most concerned. So people who are knowledgeable are more likely to have negative attitudes to data uses. And this really does call into question the, communicate clearly and everything will be okay model of managing or governing data uses, which Jen was also critical of in her talk. But one of the things that I want to highlight here, though, is what the statistics don't tell us. Okay, so we found 78% of the respondents to our survey said that they were comfortable with their NHS patient data going into the NHS COVID data store, given its kind of pro-social intention to sort of manage the pandemic well. So that looks pretty good and reassuring. But statistical support for data-driven schemes may obscure coexisting concerns. And what we found in comments in free text fields in our survey was more concern about data sharing in the context of the NHS COVID data store than in relation to the various other public sector data uses that we talked about in the survey. And more than half of these expressions of concern were about the involvement of commercial companies in the data store. And concern was often expressed as negative imagined future scenarios involving commercial companies profiting from, leaking, misusing or selling data in the future. So what's important here is comfort and concern can coexist. And I think we need to sort of think that through in our work together. And it's also important to note that across different sections of our survey, we found public concern about commercial companies profiting from personal data was high, and trust in tech companies' handling of personal data was low. So in this next slide, this shows us a section of our survey where we asked people to tell us whether they trusted various organisations or sectors to keep their data safe, to use their data responsibly, and to be open about what they were doing with personal data. And you can see that those three different data uses didn't really affect people's responses. The responses were fairly consistent across data uses, and what mattered was who was doing it. So there was high trust in my GP, the NHS, and then the police, and there was low trust in social media, the BBC, and tech companies. And this kind of explains the coexistence of comfort and concern that I just mentioned. A lot of NHS data-related initiatives involve commercial companies, so you're bringing the two together here. And they matter for trust in COVID data initiatives because these usually involve commercial companies. So governments seeking public support for such schemes might have to consider alternative approaches to how they're developed. So I want to move on and talk a little bit about inequalities and trust. So it's increasingly widely established that public sector data-driven systems can deepen social inequalities, and that experience of inequality influence attitudes to data systems. So, for example, in a survey about attitudes to data linkage, Rosalind Edwards and others found low levels of trust in organisations such as the police, criminal justice system and immigration services among Black and minority ethnic people. And in our survey, we also found that BME people trust the police less with their personal data than white people do. We found LGBTQ plus people trust the NHS or GPs with their data less than heterosexual cisgender respondents, and other similar findings have been found in other polls. One of the things that was interesting, though, in our survey was that people who don't suffer the direct experiences of inequality are still worried about them. 86% of our respondents said they were concerned about data being used in unfair ways. So data-driven approaches to managing COVID-19 need to be informed by the myriad ways in which inequalities cut through data-driven systems and how this affects trust, both of those negatively affected and of others as well. So one of the things that is interesting, apart from in Edwards' survey, is that debates about inequality and debates about the need for more trust are rarely joined up. And yet it shouldn't surprise us if sort of particular populations distrust systems which have biases written into them and organisations operating those data-driven systems. And I think we can really sort of turn to the work of Rua Benjamin here, who argues that we need to reformulate the problem of distrusting citizens as an issue of social justice by unpacking what she describes as the racial logics of trust. She's looking particularly at race and health. So we should see trust as a privilege enjoyed by majority groups and seek to better understand the roots of distrust as something that is shaped by the structural inequalities that we're talking about here, and may well be an appropriate response to systems that are developed for exclusive publics. And we also have the literature about the public understanding of science, which tells us again that focusing on the public in that equation, or this idea that the transmission of information will have desired effects, is flawed. And what we should do is turn to the trustworthiness of the systems and the organisations implementing them, which I think also confirms what Rua Benjamin has to say and is illuminated by what we found about trust in our survey. So for the last couple of minutes, I want to talk about influencing policy. So because of what we found in our survey, which I hope you can remember, I mentioned a few minutes ago, these are the recommendations that we came up with from our survey. So we suggest consider not engaging in practices that consistently concern the public. For example, sharing data originally intended for health or other pro-social purposes in ways which enable commercial companies to profit. So consider not doing that. We do come up with this suggestion to communicate clearly and fully about existing data uses and possible future uses, especially when they go beyond what is originally intended, because in the absence of clear information, people imagine negative and concerning data uses. So we do make that recommendation, but we don't think it's enough, because that is very much in the communicate clearly and everything will be okay kind of model that we are critical of. Another recommendation that we make is change practices. People who know most about data uses are the most concerned about them, again, questioning this tell people more and everything will be okay model. So if data uses continue unchanged, people will continue to be concerned, regardless of the clarity of information. We also suggest consulting with the public, especially those affected by data uses, about what changes to data uses are needed, and doing this on a case-by-case basis, because public views of data uses differ in different contexts. And finally, we say it's important to understand that some trust issues go beyond the type of data use and instead result from attitudes to organisations or sectors more generally. So to address data trust issues, fundamental changes may be needed that go beyond data uses and practices. So I want to just sort of end by reflecting on the sort of politics of influencing policy or practice in the ways that we might all want to. So on our project, the Living with Data project, on our advisory board, we have people who can help us ensure that our recommendations are seen in the right places. So we've got people from the National Data Strategy, from Information Commissioner's Office, from public sector organisations or government departments like the DWP and the BBC, from groups well connected to policy like the Ada Lovelace Institute and Understanding Patient Data. So we have lovely reports. We also had a very long report from our evidence review and recommendations from that, like yours, the lovely report that you have produced on OMDDAC. You know, but Jen's talk really told us that no one is listening, right? Where are these recommendations going? Who is listening? To what extent is there a will at all for policy to be influenced by public perceptions? Jen talked about like the consequences of not listening and of there not being a social license. But we do find data practices a lot of the time carrying on regardless of the absence of social license. Occasionally, the absence of social license results in a U-turn, as with the A-level results last year. So the question is, do our findings lead to meaningful change in data policy? Possibly there are more troubling outcomes, that knowledge about people's perception of data uses is not used to ensure that data and AI work for people in society, as the Ada Lovelace Institute want, but rather alter the messaging around data-driven systems in ways that might make them appear more palatable, even though they're not changed at all. And you know, I'm personally interested in what people think and what people feel and what people know. But when we talk about these things, it's important not to lose sight of the fact that what matters is improving data uses, not improving people's perceptions. Or sometimes what matters is halting or abandoning data-driven approaches because of their harms and costs. So we have to ask, if public attitudes are heeded at all, is it to improve messaging or is it to improve policy and practice? So there's a question here about whether public engagement is simply performative. And of course, you know, there are bigger questions about whether we think data policy should be informed by public opinion. And this depends on our sort of fundamental views about the kind of society we live in, about whether it's possible for data uses to ever be fair and just, whether this is out of the question in our current political landscape, and whether they should be governed by pro-social principles or resisted completely. And there's also a massive question about how we might take the kinds of things that Rua Benjamin is saying about the racial logics of trust and distrust into a policy environment in ways that influence and inform policy, which I think is kind of simultaneously important and challenging. So I think these questions reveal some of the politics that underlie researching public perceptions of data uses. Thank you.
Thank you very much, Helen. I think those questions that you raised at the end are, you know, absolutely vital. And especially one is, who is listening? Is anyone listening? Is there a will to be influenced by this type of research? And you know, should data policy be influenced by this type of research as well? So I think, thank you so much for that really thoughtful and thought-provoking keynote. I'd like to open, we've got about 5 minutes for any comments or questions for Helen. I'm not seeing any questions at the moment in the chat. I don't know whether I'm just not able to see them, Hugh, or whether there aren't any yet. But if anyone has also would like to ask a question, please just raise your hand. Oh yeah, I have a question for you now. That's been asked. Should the Centre for Data Ethics and Innovation be promoting this restraint the public wants and making policymakers listen? If not them, who else? That's from Tom Kim.
Yeah, I don't know if I can answer what the Centre for Data Ethics and Innovation should be doing. I mean, yeah, I guess them and whoever else is well positioned to, you know, have policymakers listen to them should be saying, you know, there are a lot of differences and there's a lot of variation in what people think, depending on, you know, the characteristics of the people themselves, the characteristics of data uses, the characteristics of organizations involved. But I do think one striking consistency is that people don't like commercial companies profiting in contexts that are ostensibly pro-social, but have a sort of commercial profit motive at the back end. And that has come up on surveys and qualitative research that I've done over a period of time, and in a lot of other people's research as well. So we did a literature review for Living with Data, which was 5 years of original empirical research in the UK, grey lit and academic lit, into public thoughts and feelings and perceptions and attitudes of data uses. We also included some international academic research as well, but we didn't have the scope to look at grey literature from anywhere else. And yeah, this is a consistent finding. It's not consistently the case that people are concerned all the time about everything. People are able to see the value of some things some of the time, but yeah, that is a message. So I mean, in itself, it's a simplification, isn't it? Because I think that people, you know, what are Amazon doing in there? What are Google doing in there? These are the sort of big tech monsters of today that we are concerned about their monitoring of data, you know, as we shop on Amazon or search on Google. But, you know, technology hardware costs money, we buy it, and somebody profits when we buy it. So do we not like that as well? So there does need to be a bit of unpacking what aspects of sort of commercial company involvement people find acceptable or unacceptable. So yeah, anybody who's got the ability to should be banging on to policymakers to heed this. I'm sorry to take ages to answer this one question, but it's partly because of the feeling not listened to that actually my own impact from my research has been much more with practitioners in organizations. So I've worked quite closely with people in BBC R&D for a while, and other sectors as well, web design, social media analytics, data visualization. I find it more you know, possible to get practitioners to listen than policymakers.
Thanks very much. And I see Alexander Babuta from CDI. I would like to just come in and respond if that's okay. So Sasha, do you want to?
Thanks, Marion. Can you hear me okay?
Yes, we can, yeah.
Okay, brilliant. Well, first of all, yeah, thank you very much for those really interesting and kind of incisive comments, and congratulations on the report, which I think is an excellent summary of the key policy issues that government needs to be thinking about in this space. Just so for introduction, I'm the AI Futures Lead at the Centre for Data Ethics and Innovation. So the Futures programme looks at the sort of medium to long-term policy implications of AI and data-driven technology. Just a very quick response, first specifically on the role of CDEI. So As many of you know, the Centre's undergone quite a major kind of strategic review, trying to more clearly define where CDEI fits in the overall government policy landscape. And the conclusion of that review is that CDEI is not a think tank, we're not a kind of university research institute, and we shouldn't be trying to sort of just be another voice in the quite crowded public debate on AI and data ethics. But where we add the most value is by directly supporting public sector organisations in what we call responsible innovation. So partnering with different government departments on specific challenging data policy and data science challenges. For example, we had quite a large number of staff seconded last year to support NHSX with the development of the contact tracing program. So as part of that new kind of model of partnership working, there are a number of kind of practical ways in which I think we're trying to sort of ensure that future government data policy fully takes into account the views of, I'm not going to use the phrase the public, but let's say diverse publics, as well as the findings from academic reports like the OMDDAC report. The first is we're developing what we're calling a model for responsible innovation. And our idea is that, our hope is that ultimately departments across government will adopt the CDEI model for responsible innovation as a sort of framework for developing a trustworthy approach to AI and data science. We are moving slightly away from the language of ethics, more to talk about trustworthiness, because one of the things that's come up consistently in all of our work is that data ethics is a very nebulous and abstract concept, but trustworthiness sort of centers it right in terms of what the public actually, what the public need, what the public expect. So that's the first thing we're doing, is developing that model for responsible innovation. And then just very quickly, the second thing we're doing is supporting the Central Digital and Data Office, which sits within the Cabinet Office, on their algorithmic transparency standard. So you will remember back when the National Data Strategy was published, there was this commitment to develop an algorithmic transparency standard across government, essentially a consistent framework for all government departments to report exactly how they're using algorithms and data-driven technology. And ultimately, the idea is to work towards a public-facing section of the gov.uk website with basically a publicly available register of the different algorithmic tools that are being used across government. So what CDEI is doing now is much more sort of focused on putting a bit of friendly pressure on different government departments to be much more open, much more transparent in their use of data, and to be much more rigorous in ensuring that their approach is both kind of empirically robust, but also informed by by public perceptions and public views. And yeah, just to sort of close, as a policy researcher working in government, I can assure you that we are listening, and the findings of research like this do get read by the right people. And the one thing that I'd sort of say to academic researchers working in this space is just, if you make the recommendations as specific as possible and directed at particular teams and particular departments, then it's a lot easier to hold people to account for implementing those recommendations. Yeah, that's it from me. Thanks, Marion.
Thanks very much, Sasha. We're going to have to move on quite shortly, but I think Helen just wants to make one final point.
Yeah, I mean, I do think this is it's very reassuring to hear what Alex had to say about listening, and also, really interesting to hear him talk about what's happening at CDEI. I do think there is a need for ongoing conversation about what recommendations look like. Alex said make them as specific as possible, and I have found, in conversations with some of the people on our advisory boards, them saying, tell us what to do. And I think I'm not an expert in your domain. Where does the interpretation need to take place? There's a meeting of our research and policy or practice, and in between some interpretation needs to take place. And whose job is it? it probably should be a dialogue, shouldn't it? But that obviously would be very resource intensive. But it's pretty hard for the academic researcher to imagine and be an expert in the multiple domains in which the findings of the research may be applied.
Thank you, and hopefully this event is starting that sort of dialogue that we need to have. So thank you very much for that, and I think that's raised some really important points about the interaction between research and policy making within government. So without further ado, I'd like to hand over now to OMDDAC colleagues Adi Janjeva and Dr. Philip Lee, who are going to take us through some of the key findings and recommendations from the OMDDAC report, and also in particular the findings of the public perception survey. So Adi, over to you.
Thanks, Marion. Just ask Philip to pull up our slides. There we go. Perfect. Great. Okay. So this year, OMDDAC published 4 snapshot reports, which were focused on data-driven public policy, tech-driven approach to public health, policing and public safety, and key findings from the public perception survey. So the last of those, the public perception survey, will be covered in more detail by my colleague Philip a bit later on. So I'll broadly focus on our findings from those other 3 areas and how we kind of took a step back and triangulated them with the pillars that are laid out in the national data strategy to produce the final research compendium that you see today. So the pillars as laid out in the national data strategy. Sorry, can we go to the next slide, please? Perfect. The pillars laid out in the national data strategy are data foundations, which refer to data quality issues and infrastructure related things. Data skills, referring to kind of data literacy of decision makers. Data availability, which refer to data sharing primarily, and responsibility. So that refers to things like law, ethics, transparency, and public trust. I think by mirroring our structure for this research compendium with the way that policymakers in government are considering data-driven policy, I think we've tried to ensure that OMDDAC's findings are as practically useful as possible and best placed to inform the kind of the crucial policy phase that we're now in, I think. That phase being a pivot away from just merely identifying the key data-driven responses to the pandemic towards identifying kind of the outcomes and the technical developments that society wants to be keeping, the ones it wants to be discarding, and the ones which require kind of more consideration. I'll now just kind of take those 4 pillars in turn and try and break each of them down a little bit in a bit more detail in terms of how OMDDAC's findings and recommendations relate to them. So firstly, data quality, so data foundation. So data quality and operational capability were seen by stakeholders as consistently hindering a more effective data-driven response to COVID-19. In terms of what the strategy says, you can see there that it says the true value of data can only be fully realized when it is fit for purpose, recorded in standardized formats on modern, future-proof systems, and held in a condition that means it is findable, accessible, interoperable, and reusable. So this picture was often proved not to really be the case over the course of our research in various different areas. Errors, omissions, outdated information were commonplace according to the people we spoke to and the research we've done, at times having a disproportionately worse impact on more vulnerable citizens who required extra support from local authorities during the pandemic, for example. This is also applied to the deployment of risk scoring algorithms, such as Q-COVID in the public health context, which has emphasized the importance of raw data quality in the process of developing, testing, and validating an effective algorithm. Using outdated or unreliable health data to inform risk stratification undermines the robustness of the algorithmic decision-making taking place, and therefore the notion that algorithms can be developed to reliably be used in informing clinical or policy decisions. So these difficulties with data quality were often amplified when data interoperability was also an issue, with different kind of public sector organizations labeling their data in different ways and having different standards for how they manage their data sets, and then go about sharing it and bringing it together with data sets from other organizations. So as well as the problem of interoperability across different sectors, our case studies that focus on policing showed how if the platforms for storing important data are themselves substandard, data interoperability within a police force and across other police forces may be undermined, and detecting any missing data is made harder. I think this relates to a broader point about data infrastructure and the capabilities that exist in different parts of government. So, you know, while some parts of local government, for example, were able to operate using more sophisticated systems, others would have relied on more rudimentary options like Microsoft Excel to process data. You know, on the flip side, options like Microsoft Excel can offer a useful baseline from which to speak to data that other stakeholders possess. In the policing context, for example, we were told that with the dozens of different approaches to recording data at different police forces, a Microsoft Excel can become the lowest common denominator and be actually quite helpful. So, you know, but whether that's sustainable as a longer term solution for managing kind of increasing inflows of data is probably questionable. So, you know, in light of these issues, we offer a number of recommendations. You know, first and foremost, the implementation of a national public sector data standards framework with that priority of enabling better interoperability. Also, investment and corrective action being directed to formally address data quality issues across the public sector. Human oversight mechanisms continuing to play a central role in relation to the application of automated decision-making tools, which ultimately feed into decisions that affect individuals. And then we also say that there should be kind of significant consultation across the public sector as part of the national data strategy to determine ICT infrastructure and resourcing needs, and, you know, facilitate appropriate and secure data sharing and analysis. With all these recommendations, these are just kind of brief takes. So further details in terms of who these are directed at can be found in the report. So on to the next slide, please. Data skills. The pandemic, when it comes to skills, I think the pandemic has highlighted a number of areas which require increased focus from a skills point of view. So just taking what the strategy says there, I'll just summarize the bit where it talks about kind of driving change across capability, leadership, and culture, developing world-leading capability in data and data science across central and local government as the kind of priority. But, you know, one of the main issues identified by OMDDAC on the theme of data skills was a breakdown at the interface between analyzing data and then deciding what to do with it, which in some ways you might call kind of turning data into information. Bridging that gap between the two and being able to meaningfully interpret and evaluate statistical outputs demands a thorough understanding of the limitations, uncertainties, and assumptions that are involved in any modeling phase. You know, without doing that effectively and deriving kind of clear utility, the public may begin to question what the value is of collecting and sharing such large amounts of data. The prevalence of these issues at higher leadership levels in the public sector may be a particular cause for concern. The National AI Strategy talks about the development of a larger workforce with AI expertise. Kind of, you know, that's speaking to the notion that it can no longer be just a handful of technologists within an organization who are truly engaged in the different risks and opportunities that are thrown up by AI to drive decision making, but that it's a wider responsibility, you know, which starts at the top with senior leadership. In some parts of policing, one of the responses to this problem has been to weave in external expertise into decision making via dedicated advisory groups. So, for example, academics were embedded into Police Scotland's optical group during the pandemic to lead on data analysis, to check that powers were being used equitably and ensure that certain social groups or demographics were not being disproportionately impacted by the actions that the police were taking during the pandemic. So, you know, that can create a setting for constructive challenge, which isn't just beneficial for the police, but also for academics who gain a better understanding of the context of police work during a public health emergency. You know, we make two key recommendations in relation to the data skills pillar. First, that going back to that emphasis on data literacy training for decision makers and policy makers to improve that interpretation and evaluation of data. particularly understanding the associated risks and limitations, and a professional standards for data science, we say, within the public sector would definitely help in achieving that aim. And second, an emphasis on mechanisms which allow specialists in methodology, so that people like data scientists and mathematicians, to collaborate better with domain specialists, so people like behavioral scientists or law and governance specialists. Okay, so on to the next one, please. On the point of data availability, so the sharing, linkage, and repurposing of data sets from a diverse range of sources has undoubtedly been central to the national pandemic response. The third core pillar of the national strategy, data availability, makes clear that this is a feature that the government intends to build upon. It says, for data to have the most effective impact, it needs to be appropriately accessible, mobile, and reusable. And that means encouraging better coordination, access to, and sharing of data of appropriate quality between organizations in the public, private, and third sectors. Now, data sets that have been shared to improve understanding during the pandemic have been extremely varied. They've covered medical data sets and non-medical data sets, as well as both public and private sector sources. And in terms of the non-medical data sets, we've seen that mobility data was seen to be especially important in informing the pandemic response, right from helping to model the R number to understanding the design and parameters of the various lockdowns that we've had. And a different example can be seen with wastewater as well, where an analysis on samples could be conducted at the community level to detect viral load and help in providing an early warning system for new cases in a certain geographical area. My colleague Philip will talk in a bit more detail about public perceptions of this particular data-driven response. The key point being raised here is that data sets which are designed for one purpose can actually provide a whole set of insights in a completely different area, which it turns out can be quite key in understanding non-observed pandemic spread. Of course, with that could come a whole set of problems if the data set is not suitable for extrapolation or use in other contexts. So caution is still needed in taking that approach, but opportunities are there. And our recommendations on this particular area focus around a few different things. So fundamentally, data acquisition, sharing, and processing activities must begin and end with robust information governance requirements which are transparent to the public. All data processing should be undergoing a data protection and human rights impact assessment at the outset, and that's something which should be revisited regularly throughout the data lifecycle on a continuous basis. And also, we talk about the design of any data sharing initiatives should aim to foster and maximize public acceptability. This can happen by being transparent about which organizations have access to certain types of data and when this data is being shared, not just assuming that the public are comfortable with their data being shared across all sections of the public sector, and also by avoiding a one-size-fits-all approach, and also providing options where possible for how much detail to share. Move on to that last pillar, please. So this final pillar of responsibility emphasizes that the sharing and processing of data must be undertaken responsibly in order to preserve public trust. So the strategy there says, as we drive increased use of data, we must ensure that it is used responsibly in a way that is lawful, secure, fair, ethical, sustainable, and accountable, while also supporting innovation research. So responsibility in the sense described by the previous quote is directly linked to the need for transparency regarding the use of data and confidence in its ability to lead to accurate decisions. I think this is where the use of the term data-driven itself can lead to some problems with some stakeholders in our research concerned that by referring to a decision as having been driven or informed by data, it gives the impression that the decision is wholly objective or beyond dispute without giving due regard to the actual complexity of the situation. When in fact, as we all know, many of the decisions that are related to the pandemic, like opening schools or imposing lockdowns, have necessarily involved the weighing up of risks and relevant factors according to policy priorities. In the context of policing, I'll touch on the issue of transparency was especially evident during our analysis of the Memorandum of Understanding between the National Police Chiefs Council and the Department of Health and Social Care, which established a permissive regime for the sharing of public health data. So I won't go into too much detail on this, but OMDDAC's research, essentially concluded that it was quite difficult for the general public to understand how public health data was being shared with the police and for what purposes. And the delay in the publication of that memorandum of understanding allows for kind of uncertainty regarding the possible linkages of health data received by the police with entirely different records that they may possess, and how their data was potentially being segregated from other data in police systems rather. So I think that emphasizes the importance not just of transparency, but also the timing of that transparency and the manner in which key public concerns are addressed. And the opportunity for parliamentary scrutiny also plays into this discussion too, because in this example, the introduction of the amendment to the health protection regulations in January 2020 was done without being debated in Parliament first. So that can feed into views amongst the public that the government were treating this as a public order crisis rather than a public health crisis. So what we say in terms of our recommendations here, firstly, to ensure transparency, future policy decisions that are informed by data modeling should be accompanied by explanatory statements, which are published in a format that's accessible to all sections of the public. All sections of the public, including young people, as we touched on at the beginning of this event, should be as transparently informed as possible about which organizations have access to their data. And then on that final point about the MOU, where memoranda of understanding are agreed between health agencies and enforcement bodies regarding sensitive health data, it's really vital that the terms and conditions are made as transparent to the public as possible. I realize I've got to hand over to my colleague Philip very soon, so I'll just leave this on the board for a few seconds, just to draw some attention to a page from our practitioner guidelines that we've put out in a separate document today, where we've kind of adapted the 7 principles of public life, more commonly known as the Nolan principles, to try and set out a high-level framework for practitioners to measure their actions against over the course of a data-driven project. So I won't say any more about this. Do check it out if interested. So I'm going to hand over to my colleague Philip now, but that's just to touch on that very quickly. Philip, please go ahead.
Hi, thank you. So hello. Let me change the slide. Hi, I'm Dr. Guangchen Li, and I'm a senior lecturer in statistics at Northumbria University, and I'm part of OMDDAC. So today I'm going to talk about the findings and insights from our public perceptions study, which forms part of OMDDAC. Within this study, we conducted 2 online surveys. Both surveys aim to understand what the UK public thinks about data sharing in response to the COVID-19 pandemic. One of the things that our survey have revealed is the concept of diverse public that Professor Kennedy mentioned in her excellent talk. So I will say a bit on this later on. So what was the motivation behind our surveys? Since the start of the COVID-19 pandemic, the UK public have been asked to share data in ways that have never been seen before. The widely known examples include the digital contact tracing apps and the regular reporting of COVID-19 test results. These data collected from the public have played a vital role in understanding and in controlling the spread of the virus. However, little work has been done to understand from the public's standpoint their willingness to engage with such pandemic-motivated data sharing initiatives. So our surveys aim to gauge public's willingness to share data in response to the pandemic and to understand how different factors can affect people's willingness to share data. So our public perception study consists of 2 surveys, the medical and mobility data survey and the wastewater survey. As their name suggests, the 2 surveys focus on different types of data one on medical and mobility data, and one on data collected through wastewater sampling, which is, you have heard throughout today, which is a novel health surveillance approach that has been employed during the pandemic. The medical and mobility data survey has 1,003 UK participants, and the wastewater survey has a smaller sample of just below 300 UK participants. The samples in both surveys are national representative in the sense that the sample characteristics on gender, ethnicity, and age closely match those in the 2011 UK census. So we have published a snapshot report and a series of blog posts detailing the design and the results from both surveys. So the focus of this talk here is to highlight findings that are similar in both surveys. In terms of design, both surveys included questions based on the so-called choice-based multiple conjoint design. Under this design, participants were presented with two different data sharing scenarios, as shown here as scenario A and scenario B. They were asked to choose the one under which they were more willing to share their data. And this comparison is then carried out over a number of different scenario pairs. These data sharing scenarios are characterized by a number of data sharing attributes. So these attributes are the factors that we think will influence people's decision making. In the medical and mobility data survey, we have 4 attributes, and they are summarized in this table here. Each attribute has different specifications, and most of these specifications are self-explanatory, apart from info insight under the data holder column, which is the name that we use to represent a hypothetical commercial company in our survey. The wastewater survey has the same multiple conjoint design. In this case, we have 3 data sharing attributes, 2 of which the UK COVID-19 alert level and the data holder are the same as in the other survey. And here we consider the third third attribute on sample coverage. So the idea here is to see how the public feel about obtaining these wastewater samples that link to different geographical sizes, from as narrow as the street level to as wide as the county level. Now, to analyze the conjoined data, we apply the multinomial logic regression models. This graph here shows the estimated effects of each attribute on people's data sharing preference. And these results are from the medical and mobility data survey. So we have 4 data sharing attributes. For each attribute, we are estimating how preference changes if we switch from the reference setting of the attribute to other settings. An estimate lying to the right or to the left of the vertical line indicates greater or lesser preference. So now let's go through the estimates. For the different alert levels, participants prefer to share data when the level was higher. For data type, participants preferred sharing their medical data rather than their mobility data. For the different data holders, participants prefer to share with their local authority and public health body rather than with their regional police force and our hypothetical commercial company. And finally, our participants prefer sharing anonymous data rather than identifiable data where their names and addresses were part of the data share. Now let's turn to the results from the wastewater survey. So these are the estimated effects of the attributes on data sharing preference. For coverage, participants prefer to share data when the sampling is carried out with a wider coverage. For example, people prefer sampling at the the samples are taken at the town city level as opposed to sampling at the street level. And when we bring the results from the two surveys together, we can see how similar the estimates are for alert level, and for data holder. This suggests that the context under which data sharing is requested and the organizations that the UK public prefer to share the data with are consistent, irrespective of the type of data is being shared. In our survey design, we also added 2 additional questions after each conjoined comparison. After choosing the preferred scenario, we asked the participants how willing they were to share data under the scenario that they had chosen and also under the one that they did not choose. This is done through a 5-point Likert scale from very unwilling all the way up to very willing. We then model the Likert scale data from the preferred data sharing scenarios using latent class modeling. The idea here is to group participants into different clusters so that people in the same cluster gave similar answers to their Likert scale questions. We found 7 clusters in the medical and mobility data survey and 5 in the wastewater survey. But the interesting thing here is that quite a few of these clusters are found in both surveys, and we will look at these common clusters over the next few slides. In both surveys, we found what we call the committed to sharing cluster and the eager to share cluster. Participants in the committed to sharing cluster almost always chose very willing to share data under their preferred scenarios, and people in the eager to share cluster almost always chose willing to share. The fact that there is very little variation in their choice suggests that the attribute settings in their preferred data sharing scenario had very little influence on their decision making. We also found what we call the undecided cluster in both survey. Participants in this cluster often answered neither willing nor unwilling. Occasionally, they chose unwilling or willing for some of their preferred scenarios. But compared to the previous 2 clusters, there is a lot more variation in choice here. So the larger variation in choice and their undecided nature suggests that the participants' willingness to share data depends heavily on the attribute settings of their preferred scenarios. In both surveys, we also found what we call the resistant to sharing cluster, where participants often chose unwilling to share. But the positive note here is that under certain preferred scenarios, people in this cluster were willing to share their data. So in other words, if things were set right, they were happy to share data. Based on the survey results, we conclude with a set of recommendations. The design of any future data sharing initiatives should be transparent about which organizations have access to what data and when this data is being shared. And we should not assume that public are equally comfortable with their data being shared across public and private sectors. And if possible, we should avoid a one-size-fits-all approach. To finish off, I would also like to emphasize that the analyses that we have carried out so far only scratches the surface of the large amount of data collected through these 2 surveys. There are still more exciting things that we can do and to learn based on the data collected. For example, one of the next steps that we are planning to do is to incorporate the participant demographic data and the data on perceptions and experience of COVID-19 into our analysis. And by doing so, we can explore possible relationship between participant demographics and the cluster allocation. Now, in addition to analyzing the data, the clustering results from our surveys can be used to guide follow-up surveys so that we can understand why participants in certain clusters are unwilling to share their data. So there will be more interesting results to come and more work to do. And thank you.
Okay, Phil, thank you very much, Phil and Ardi, my colleague from RUSI, for your presentations. So the next session that I'm going to chair is a panel session. I'm delighted to introduce three panelists. The first one is Dr. Ian Brown. He's a visiting professor at, I'm going to say FGV Law School in Rio de Janeiro, because I can't pronounce the full name, but Ian, if you wish to, you're more than welcome to. He was previously Principal Scientific Officer at the UK Government's Department for Digital, Culture, Media and Sport, Professor of Information Security and Privacy at the University of Oxford's Internet Institute, and a Knowledge Exchange Fellow with the Commonwealth Secretariat, as well as, like myself, an erstwhile UK National Crime Agency employee as well. Joining Ian is Dr. Anna Badusky. She is an Associate Professor of Law at the University of Exeter and a Senior Research Fellow at the Geneva Academy of International Humanitarian Law and Human Rights. She currently leads the UKRI ESRC funded project on COVID-19 human rights implications of digital certificates for health status verification. And lastly, and by no means least, the third panelist, Dr. Andrew Angeli, is Deputy Director for Innovation and Partnerships and Environmental Monitoring for Health Protection at the Joint Biosecurity Centre, the data and analytics arm of the NHS Test and Trace programme. And prior to joining the Joint Biosecurity Centre, Andrew worked in both the Office for the National Statistics as well as the Cabinet Office. So welcome all three panellists, thank you. And I would remind, obviously, those attending that please use the Q&A function to ask questions. But if I could start, perhaps, Dr. Ian Brown, with you, just to get some of your views and opinions on what's been discussed today, please.
Hi, everyone. Thanks for inviting me along. Thanks to Marion and the team for, I think, a great event, really interesting research, I think very well communicated in a form that hopefully, as Helen and others were discussing, will have an impact on policy making. I know from my time in the civil service that is not easy. What I want to do just very briefly is I've been one area of research over the last 18 months for me has been looking quite closely at England and Wales and other national contact tracing apps, because they're a really interesting case study in data protection by design and default, as the GDPR puts it, which is a legal requirement, also in the UK, at least until the government goes through with its data protection reform plans. And clearly this was a quite extreme stress test of many aspects of the regulatory and legal regime. And so what I want to do is pick up some of the points I've found in OMDDAC's final report and perhaps link it to observations I and others who've been looking at contact tracing apps have come up with. Clearly these are this is software that is not just important. Many governments have said so. There is some evidence, it's provisional just because it's still relatively early days, that these apps can have a significant impact on reducing transmission of COVID. But also, clearly, these are very important to individuals because they can give instructions to individuals that they are, from a strict legal perspective, strongly advised to self-isolate. I'll come back to the decentralized nature of the app in England and Wales. Of course, one consequence of having a strongly decentralized model, as England did, is that would have been very difficult to enforce, actually. Of course, the government didn't make much of that in public communications to the public, but it was only ever actually in practice advisory. Although if you remember the front page headlines for days and days at a time over the summer about the pingdemic, you could see that many people took that, were very concerned about that and actually thought it was causing difficulties. I'll come back to that in a moment. So some relatively straightforward and obvious observations. First of all, thinking about if we think about 3 phases of the app and much of the rest of the infrastructure, the data sharing tools and so on, that OMDDAC has been looking at, there was what came before, pre-November, say 2020, there was a rapid design and deployment phase of the tracing app in England and elsewhere, and then there has been an operations phase since then. So clearly, first of all, the data and software infrastructure was lacking to build on. That was one reason that it was really quite a time-consuming process in England for the app to be put together, important design decisions made, and then for it to be deployed over 6 months after NHSX and others in government started looking at it. And I know, of course, it's easy with hindsight to look back. It was the case that, as is widely known, respiratory diseases were very high on the UK's risk register. But not just that. More specifically, I know colleagues at Cambridge University and elsewhere have been researching this kind of tool for over a decade. They thought originally it would be for severe flu outbreaks, but of course very relevant as it turned out with COVID. So that was something where there was excellent UK government-funded scientific research, but that was of some help to NHSX and others in thinking about the issues raised, but it could have gone a lot further if that had something that had been perhaps prioritized alongside identification of respiratory diseases as serious national security risks in the UK. Alongside that, some of the important legal questions, even at that phase, that the app raised about, for example, you'll remember long debates and frustration in the English government and actually other governments as well, Germany and France, amongst others, wanted initially to go for a centralized tracing app model and were very frustrated that Apple and Google would not go along with that, would not enable the functionality in their smartphone operating systems that might have allowed that. I think those were legal questions that were to some degree foreseeable, if novel in the form that has been presented here. So I think those are things that could have been dealt with better earlier, and I think that's a useful model for improving the UK's preparations for the next pandemic and other kinds of national emergencies. I think there is something to be said, as much as I am for democratic control of technology and technologies being designed to help humanity, not the other way round. Those were very serious questions about privacy and human rights raised by tracking of individuals using their mobile phones. And I think there is something to be said that governments cannot straightforwardly perhaps get their own way on certain data gathering questions like that. And I think that's an interesting legal discussion to be continuing with into the future. I noticed, just as a very specific point, there are lots of interesting quotes in the OMDDAC report from their interviewees. And one that was very relevant to this, I think someone from government, if I remember, an interviewee said the app could do much more if it did not have the data protection by design format. That's page 18 of the report. Indeed, that's true, but as that interviewee also recognized, it would have had potentially a serious impact on take-up. And this is really fundamental. This is a very fundamental data protection issue. This is not a GDPR issue. This is something that goes back decades, goes back to the 1970s when states were first designing data protection laws. Data minimization, as it's called, is a really core principle of data protection law in Europe and in many other countries. And its human rights equivalent, proportionality, is an absolutely critical part of human rights conventions going back to the 1950s. And actually the Parliament's Joint Committee on Human Rights published a report, I think this was last year now, looking at human rights issues raised by test and trace. And this is something that they flagged several times. They thought that because of some of the issues raised by the tracing app, there should have been specific legal protection, even going further than the technical protection for the data. But that was something that the government was not willing to do. And I, on the one hand, very much agree with the project, with OMDDAC's recommendation that government will have to consider in some circumstances limiting its access to personal data to maintain public trust. That's not something governments in general, and I must say the UK's government, I don't mean this specific set of ministers, I mean going back many years, is something that I know from long experience as an academic and a civil society advocate, is something it's difficult to persuade governments in the UK to acknowledge and to follow through. Then thinking particularly about the design phase, I think one positive thing I could say was that the Department of Health and Social Care did recognise there were important ethical issues raised by the development of a tracing app. They set up an ethics board to consider them. That board did produce a useful report, although the board pointed out that because of the speed of app development, it had been difficult for them, quotes, to explore the ethical implications of the technology choices and tests that were being undertaken to evaluate the effectiveness of the app. The board was frustrated at points about the quality of information it was given and, quote, did not always feel that suitably comprehensive or final answers were supplied to that questions. And then finally, from the board's report, quote, journalists had received briefings that appeared to be at variance with those being presented to the board. Sometimes technical information that we regarded as ethically significant and had requested was not available to us at the point when we needed to crystallize advice. Ethics boards are a very commonly recommended mechanism for governments and for other users of data, personal data, to help them think through the ethical consequences of their decisions. And acknowledging this was an emergency and the government understandably wanted to move as quickly as possible, that was something that did not fully work in this context. I think the board was sometimes even slightly being politer than they, I know, were in private talking to some of them about that experience. The UK, of course, like all other countries with GDPR type frameworks, does have a specific regulator responsible for enforcing data protection law, the Information Commissioner's Office. The ICO gave a lot of help to NHSX in designing the app, and I'm sure that was helpful. There's always a concern when regulators act in that advisory role that they become too close to the parties that they are advising, and concerns then about whether, if their advice is not followed, that enforcement action will take place. That didn't happen in the UK. It happened in Norway. So that, there were other data protection authorities in Europe that did feel the need to take enforcement action about some aspects of the way that their tracing apps operated. Then thinking about the operation phase, once those centralized versus decentralized debates have been settled, the UK, England, sorry, I should be specific, England and Wales deployed their tracing app in September 2020. It had very positive take-up. I think around 60 million, just from the top of my head, was around the level that the government, the Department of Health has said they'd got up to with a number of users. You might remember in the pandemic headlines concern that people would switch off the tracing app more recently because people felt, didn't trust the notifications that were coming from it. I mean, trust, as Helen said, it has all sorts of nuanced aspects. It was that I think I would love to see, and I'm sure it will come over time, nuanced social scientific research into this as a hypothesis I would have to investigate further than that. I think part of the issue is people didn't feel perhaps they fully understood what information was behind the notification. Part of that was as a result of a deliberate privacy choice that was made not to reveal to individuals who it was they'd come into contact with that had led to the notification. But of course, that means people don't know context like were they inside or outside, which is very important for transmission. Were they in a crowded room, on a train? So I think that's an example of a more difficult trade-off you see in discussions about data protection and by design. I'm not going to share them now, all sorts of thoughts about Helen's very useful points on, do policymakers listen to evidence? It was actually my job for over a year in DCMS trying to do that. I left, which tells you my answer, but perhaps we can come back to that later.
Thank you very much, Ian, and there may well be some questions on around that as well. Very interesting, and thank you very much again for sharing your thoughts and your experience with us. Can I ask Dr. Andrew Badusky whether you have any reflections on thoughts on what you've heard today, and your own perceptions of the issues that we've discussed?
Yeah, sure. I'll be very happy to offer some comments. First of all, I'd like to thank the OMDDAC and the organizers for this excellent event and excellent report, which I hope will indeed fall into the good ears of our civil servants and policymakers and will make a difference in policymaking. I would like to comment on three main aspects that arise from the report and from the discussions of today, and that relate directly to my own research, which is funded by the Economic and Social Research Council under the UK Research and Innovation Rapid Response to COVID-19, and relates to the implications that COVID certificates have for data privacy and human rights. So the first point that while reading the report was very coming to mind and very important to me was the increasing levels of data sharing and data availability about in particular sensitive types of data relating to COVID-19, for example, COVID test results and COVID vaccination records in a digital format that became more and more available during the pandemic, but also that relates to this trend of having more of a digitization of a number of domains, including the healthcare domain. And so one thing that I think it's important to think about is how this type of digital tools, such as COVID certificates that build on this type of sensitive data, such as COVID test results and vaccination records, can be used in a good way to manage the effects of the pandemic, especially during a time where we were going through lockdowns and having a reduced mobility of individuals, and that this whole idea of proportionality on is it better to have a rigid lockdown regime or to have some mechanisms that would allow people to have this type of mobility back in place. These were very useful, but one aspect that was quite important in my research findings was that they have important implications for data privacy and human rights more broadly. And these are not simple ways of thinking about those, because there is this question of exercising some sort of proportionality exercise there, whereby policymakers would need to take action, but at the same time make sure that they protect the rights of all individuals within their jurisdiction. And that was something that was quite interesting to see playing out in the field. The second point that comes out of the report prepared by OMDDAC is the need for standards or framework for using data in this field relating to COVID-19. And that's also something that speaks to my own research findings on my research, where I interviewed a number of experts on the area of digital identity and certification. And this lack of global standards was something that was very much one of the main concerns in that regard for the effectiveness of the implementation of these certificates. So nowadays we're seeing that the certificates are quite useful in a way for international travel, and there is a consensus being brought to light about the use of the certificates for international travel, less so concerning domestic uses. And one of the problems is that we don't have standards in this field. So for example, for understanding how we can use data of someone that has had vaccinations somewhere else in a third country, and that would want to use that, for example, in the UK. And that has been something that I think has evolved already with time, but I think we really need to move forward in terms of having standards for that and thinking ahead for the next type of crisis that might intervene, and how do we make sure that there is this preparedness in this sense on having standards in place. And finally, a third point concerning the legal frameworks that would be necessary to set out clear restrictions and limitations, for example, on data acquisition, on data sharing and processing of data. That's a point that I found very interesting to see in this report, and I think it's very necessary as well to see there. It's very welcome in the report. And again, something that directly relates to my own research on the topic of COVID certificates, which is a narrower area than the one studied by the OMDDAC team. But there is this clear need for having legal frameworks in place, and also to understand that these, for COVID certificates, they are not being deployed and they do not operate in a legal vacuum, and that the existing norms apply already. So data protection rules, but also human rights rules, they already apply, and they should be respected in this sense that, for example, if we're thinking about human rights, we would need to have a whole discussion about whether these tools are being deployed in a way that is compatible with a number of human rights protections, such as non-discrimination, such as rights to equality of treatment, but also privacy. And I think that's very important. And so these three areas, I think it was very interesting to see, not just on reflecting on what has been done so far, and what has been the response of a number of countries, including in the UK, for the pandemic management and the uses of data and digital tools, building heavily on data, but also on preparing for the future and for post-pandemic worlds where the digital infrastructure will be there. And so how are we going to deal with that? So one of my recommendations that I had in my work on COVID certificates was, for example, to establish clear legal boundaries, for example, using sunset clauses, which would determine that these digital tools can be used just until the pandemic is there. And once it's not, we're not in a pandemic anymore, they shouldn't be used anymore because they would not be necessary anymore. But something to think about and have these types of sunset clauses built into legislation. So I'll stop there. Thank you so much. Looking forward for the discussion.
Anna, thank you very much for your comments as well, and good to hear about the work that you're doing as well. Mindful of the time, I'd like to introduce our third panelist, Dr. Andrew Angeli. Andrew, please. I know we're moving towards the latter stages, but we're still very interested to hear what you have to say. So please, your reflections on the report and other matters related to this as well.
Yeah, thanks. I'm going to thank the organisers, obviously, for a really stimulating and I think a really rich conversation. And I've had the privilege to been invited to a number of events like this recently, and I think it's just proof that we really do have very sophisticated and important conversations about data and data privacy across not just government, but across academia, and most importantly between government and academia, and of course other organizations. So I read the OMDDAC report with great interest. I do want to just make a slight correction, which is not the fault of the organizers at all, which is that I'm actually now part of the UK Health Security Agency. So the Joint Biosecurity Centre was my home, but that has now become part of the UK Health Security Agency. And that does have a subtle importance in the sense that I sit with the teams who have done a lot of the work that have been, that's been discussed by Ian, by Anna, and by others. So it's really quite interesting for me to see the perspective a little bit from the outside, having also seen a little bit of it sort of from the inside. And what I would say is that so much of this resonates from my side of things. So when I read the OMDDAC report, for example, as I walked through the 4 main sections, each one of those sections spoke to me in a way that I think just shows that the research is not just sort of important and timely, but it's really it's really got its finger on the pulse of what's been going on in the data space. I'm going to make one observation, and then I'm just going to sort of toss something in which I think has not been touched on here, which is for me a subject of great fascination. So a couple of things. The pandemic for us also provided the opportunity to work with a lot of colleagues from the private sector. And I've been part of discussions where people have said, well, the private sector is so far ahead of government in terms of data sharing and infrastructure and those sorts of things. And actually, I sometimes contest that. I think one of the things that the pandemic showed from our side of things is that when we were working with a lot of colleagues from the private sector, that our protocols in terms of data quality, data standards, but also most importantly in terms of data privacy and data ethics, are really robust inside government. I'm not going to sort of get into making comparisons, but I'm just going to say that I think that government is handling data in most instances, as well as any organization that I've worked with during the pandemic. I want to come to something. So my observation here, which has not been touched on, which is, so I run the wastewater program, and the findings in the wastewater program are obviously of great interest to me, and we have done a lot of work with the public around this, testing public attitudes on wastewater monitoring, and so there was a lot in the report and a lot in the findings that were discussed today, again, that chime with the kind of work that we've done. But wastewater data is innovative in another way, and it's sort of challenging in a way, which is that it raises a question, which is, when do data actually become personal? Or when data are personal? And if you look at every definition of personal data that are sort of either contained in GDPR, around GDPR, promulgated by the ICO or anybody else, and we've had multiple legal opinions on this, wastewater data is simply not personal. And I'll explain. We don't, well, feces, poo, is the way that the viral fragments get into wastewater, but everything dissolves in wastewater, and we simply monitor the levels of viral fragments in the wastewater. So there's literally nothing human that we test in our samples. And if we ever find any DNA in there, it's discarded. So there's no personal data. And it would be really, really hard for us to actually connect the data that we have with any individual. Now, that's a slightly different thing to saying that the public don't have a right to be concerned about this. So, so I think it's not so much around, the discussion's not so much around control of my data, but there is a real ethical consideration here, and those are two very, very difficult conversations. So one of the things that we did is that we did and I can talk about this because it's just about to be published, so you can look out for this in the next couple of days if it has not already been published today. But in DHSC, we led a large-scale public consultation around 5 different dimensions of data, including wastewater data. And what we found is that, we talked to the public, and I think that those personas that were discussed in the cluster work, it sort of resonate as a starting position. But once we began to talk to citizens about what those data actually represent, what they actually are, what we saw is a really large shift within the wastewater data, much bigger than in any other area that we looked at. So once people began to understand that we weren't actually looking at anything individual, and began to understand that we were looking at sort of cumulative level of viral fragments that we sample at various points in the sewer system, then sort of, I'm paraphrasing a little bit here, but sort of the end point for that conversation was, well, this is a no-brainer. We absolutely should be doing this. In fact, why aren't we doing this more? And so I think that, yes, it's important to do the research, but a point that I've made quite a lot is that public engagement over these things needs to be sophisticated. Yes, transparency is important, but it needs to be an ongoing process. And I think we've still got a long way to go. That in Helen's discussion around trustworthiness, that really resonates to us. Our job is not to be trusted. Our job is to demonstrate that we are trustworthy as an organization. And then if people choose to trust us or not, that's another matter. That I think is the standard to which we aspire. So anyway, I'm just going to sort of leave it there. But that for me, that bit around when are data personal, it's not as easy as we might think.
That's very interesting, Andrew, and thank you very much for joining us. I know you've got other commitments as well, so I do appreciate you giving up time and for sharing your thoughts with us. I think we may have time very quickly for one question at least. So let's go for this anyway. And it's sort of building on what you were saying, really, Andrew, and you and the rest of the panelists, please consider this. But the experience of the Contact Tracing Ethics Board, does that mean that ethical reviews and ethic boards are in general in an ineffective way of oversight of data usage by the state?
I wouldn't try to draw too much just, from this one experience. So I wouldn't make such a sweeping statement, Keith, but I suppose what I was pointing out was they're often seen as, perhaps the single most important mechanism. And in this case, they didn't, they work to some extent, but, they can't be the only protection.
Okay, thank you, Ian. Andrew or Anna, anything to add to that or not really?
I think Ian is a very, very good response. The only thing I'd add is there's something about pace here as well. And I think one of the challenging things in the pandemic was that we were constantly finding ourselves knowing that things were desirable, but also knowing that just because they're desirable doesn't mean to say you should do them or cut corners to get there or do things faster just because. So I think balancing a sense of public emergency and real threat, let's not forget how many people have been affected by this pandemic in so many ways, but balancing that still with a real strong public obligation to make sure that we go through those due diligence processes. So I think for us that has been really, really challenging, and I think we've got probably a lot of lessons to learn from that.
Okay, thank you very much. And again, I don't know if we've got time, so obviously your thoughts are all going to have to be fairly short, sharp, and to the point. But another question, the decentralized nature of the English contact tracing app had a detrimental impact on its public health effectiveness. Do you think that's the case? And if so, was there a way that a centralized version could have been built in a trustworthy manner?
Well, first of all, I don't know that there is clear evidence it was detrimental. This was a comment of one interviewee to OMDDAC that they thought there was more it could have done. But it was a hypothetical. And I think actually a point I want, which I think is really important from the experience we've had in the UK is we've seen a lot of misinformation on social media about various aspects of what the government has been doing and how people should respond. And my personal experience has been with the app, because that really strong technical protection was there. I found that very straightforward to explain to various people getting upset on social media who were claiming, they were being tracked by the police through the tracing app, saying that people shouldn't install it. It's really easy to point out that is not possible. And it's not only the UK government saying this, here's the Apple and Google page explaining how the technology works. So I think that element of, which was something that also came over very strongly in the OMDDAC research, of transparency leads to trustworthiness. That's the T word again. It's not the only part of it, but I think it's a really essential part of it. And I think that, hard limit on how the data could be used made it really straightforward for government and others to explain, you know, the app was not being used in ways that people were concerned about. So that, you know, there were some big benefits came out of that as well.
Excellent. Thank you very much, Ian. If Andrew and Anna don't have anything to add, I'm going to ask a very quick question of Andrew, if I may, if that's okay. And it's about the non-personal nature of wastewater testing. Does this depend on what is being tested and how it is used?
Great question. There's probably dimensions to that question that I'm not even aware of. Yeah, I think all data, the characteristics of all data are contextually bound. One data point in one context is not the same as a data point in another context. We were asked this quite a lot during the public consultation on, and I get asked this all the time, so, well, could you monitor wastewater outside my house? And I come back to it, you do have to remember what we're looking at there, which is we are looking at feces that are deposited in the sewer system. And is it feasible or desirable? It would certainly be really resource intensive to sit outside a house and wait till somebody poos in order to determine whether they've got COVID. As I always say, well, probably just ring the doorbell and ask them if they want to take a test. A much better way of doing things. So the questions that we're asking are completely different questions, and we're looking at community level health status, or the health status at a community level in the most genuine sense. Yeah, there's probably things to that we, yeah. Sorry, I'm going to trail off there, but contextually bound is what I'd say.
It's fine, and I feel slightly embarrassed at the end of this excellent session. We've ended up talking about human feces, but there we go. Listen, it remains for me to thank you, Andrew, Anna, and Ian. I'm sorry, but time's probably got the better of us, but I suspect we could, this is an interesting subject that we could talk about for hours, if not days, I'm sure. But thank you from myself for giving up your time, sharing your thoughts, and for answering the questions as well. I'll hand back to Marion then, please.
Thanks very much, Keith, and just echo a huge thanks to all the panelists and to Helen for her talk. It's been great, and I think I've had so many more questions I would have liked to ask, and I think that demonstrates that there's still huge amounts to be done, and further, hopefully, I'm sure that further, we will engage in further discussions in the future, and I'm hopeful that CDI and others will be able to facilitate that. The key messages for me, firstly, what Ian said at the end there, transparency leads to trustworthiness, or at least it's a big part of it, and also that everybody has emphasised that context is so important in this discussion. So thanks again to everyone, and we look forward to keeping in touch, and would welcome any further comments or feedback on the report that you might have. Thanks very much, everyone.